Very much, Fatima. It's a very global issue now. It's very speedily increasing. I call them subfertility. It's not infertility because they have not been checked out. They're infertile or sterile. So subfertility is an issue which is affecting both male and female. Previously, it was more affecting females. They were going for tubal insufficiency and all that. But now it is more of a male-oriented issue now.
When you say male, what do you mean by that?
Meaning the problem of the sperm, the problem of the act, and the problem of the internal cell health of the males also, including systemic diseases. So there are more than 25 to 30% of subfertile cases where we are unable to find any reason.
Can you explain what is subfertile?
Subfertile means they have their uterus, they have the regular cycles, the husband has the sperms, the passages are open, even then they are unable to conceive.
Right.
After a married consumption life of more than 1.5 to 2 years. Some of them say, okay, it depends upon the age. If your age is more than 30 and you are recently married, don't wait for 1 year. But you have already crossed the border. So you have to go to the doctor as soon as possible to rule out the possible reasons of your inability to conceive even at this point of time within 6 months. So 6 months to a year, depending upon the age, if you are not conceiving, please consult a doctor to know why. Now this why has to be addressed. There are so many whys which have surgical interventions. There are so many whys which has endocrinological pathologies. There are so many whys which are addressing to systemic diseases resulting into the subfertility sessions for the male as well as for the female. There are occupational hazards. There are mobile hazards. There are lifestyle hazards. 99% lifestyle changes are the ones which are ending up in subfertility. So leave apart the reasons. What we can do as physicians, as normal people, to prevent subfertility, that is something which you have to address now, because the girls who are about to get pregnant, they have to be surely taken care. Now the couple comes to you, that both of them are okay. What do? Look for the reason, okay. Now what?
When you talk about look for the reason, let me talk from the layman's language. As far as a woman is, what I understand is, as far as a woman is concerned, the egg which is called ovum is good or not. As far as a man is concerned, the sperm count and the motility, how fast it's going inside.
Let me give you 2 minutes.
Can you just in a very simple way?
It's a story of passages, passengers, and environment. Passages, passengers, and environment. Come to the female, you're trying track, starting from the fallopian tubes to the cavity to the outlet, dictated by the brain, age, hormones. Now, if these passages are okay, but the ovaries are aged, they are not producing eggs, that means no use, there are no eggs. Or if there are associated problems which are controlling the quality of the egg, the quality of egg is compromised the minute you are born. You are born with premature eggs. More than 3 million eggs they're there. But the minute a mother gives birth to a girl, and then in 10 years of time, these eggs start declining, dying, and by the age of 45 to 50, they're all gone. So, early aging. Now we are seeing early aging of the ovaries. Woman is young, she's just married, 24, 25, behaving like a 45-year-old female. So these are the reasons which are now getting commoner. Early aging, not as a part of general body, ovarian aging. So this is the part.
Why is that happening?
There's a lot of reasons. There are a lot of local factors, there are a lot of stress factors, diet factors, lifestyle, weight, chemicals going in, not getting a detoxification, and also use of drugs. Unwanted, because they don't want to get pregnant. They are studying. I don't want to get pregnant. They are on the pills. 10 years, 15 years. They shut down their ovarian function, and by the time the ovary is resuming, the quality of egg is already declined. So the passengers are the eggs in the female. For the male, the passages are the tract through which the sperm is going to pass. or there is a congenital problem, no track. Sperm is there, cannot come out. So, obstructive azoospermia. Passages are there, but got in trouble by some surgeries, got in trouble by some swellings, got in trouble by trauma. People play. During childhood, they got the measles and mumps. Men, at their younger age, if they have viral attacks, they might end up in destroying their sperm counts, the quality of the sperm count. DNA fragmentation. If I want to speak, I can speak on DNA so much, but we are working on the internal cell health maintenance. So DNA fragmentation, maybe you have 200 million count, but the quality of the sperm is not okay. The sperm is not moving. The cup which the sperm has to penetrate into the egg, it cannot because there is no enzymes there. So the passenger of this side, the sperm, is not a healthy passenger. The passages are not okay. And above all, the environment in which these passengers are growing and they are taking care to a mature stage is not up to the mark, because the maturity depends upon diet. The maturity depends upon environment. The maturity depends upon your lifestyle. The maturity depends upon your occupation. The maturity depends upon what you are drinking. The maturity depends upon how you are sleeping and how long you are sleeping. Physical exercises. There are loads of factors now. Even the mobile in your pocket is going to give a bad sperm. The laptop on your lap is going to destroy your testicular function. It has been proven by the scientific data already. So whatever you are thinking, whatever you are doing, you are damaging your cells every minute. So this is the story of the environment.
So can I say?
Yeah. What we are dealing with now, we are insecure. We don't know. The patient comes to us, what level of damage he has already got, and is it reversible or not? If the sperm is okay, but the track is not there, we are there for IVF. What if we get the sperm, we get the egg, it cannot fertilize, IVF cannot happen. Even if we do ICSI, intracytoplasmic sperm injection, if the cell is abnormal, chromosomal abnormalities will not let the egg fertilize. And the end of the story.
So you have been in this field for over 30 years, right?
27 years.
About 27 years. And compared to when you started your profession as a gynecologist to now, do you see the percentage of this subfertility or infertility much increase because of all this?
Not only that, Fatima, that the age is advancing. We are having technologies, we are having drugs, we have got, IVF is there, ICSI is there, sperm donation is there, egg donation is there, surrogacy is there. So we have we are fighting for betterment. But at the grassroots level, we are not taking care of our kids, we are not taking care of our environment. Pollution, diet, lifestyle, damaging the environment I call myself as a farmer. I'm a farmer. Give me the good seed. Give me the good ground, give me the water on time, give me the sun on time, give me the good pesticide, then only I can have a nice plant. This is what a human being is. If the uterus is not okay, if the egg is not okay, I cannot grow mango in the season of pomegranate. So that's how we are trying to make people pregnant when they are not ready to be pregnant. And there is a lot of aging process. The aging process is not coming from internal issues, it is coming from your external issues, more so of your diet and lifestyle. So now we come in there as a naturopath, as a dietitian, as environmental. We cannot fight back with the environment, we cannot fight back with water, the poisoning of food itself, the arsenic. The fish we are eating, most of the fish has got estrogen. Now there's a beautiful saying that the modernization of time has given us two things, cancer and infertility.
Cancer.
This is the penalty that we pay for modernization. So our drugs are giving relief to the diseases. But what about the uneasiness of unnatural lifestyle, unnatural diet? Nobody is careful about it because it is not making you sick. Having no babies doesn't make you sick, it's only make you crazy. So the only thing is that we have to define where we stand and when do we have to go to a doctor. Don't wait. If you are above 30, go to a doctor immediately after 2 months or 3 months if you are married. Now what we can do as a part of DXL therapies, as a part of diet controls, Ganoderma, one of the best antioxidants. DNA fragmentation, people now, at the end of the day, the research is saying, oh, this male DNA is fragmented. That's why this sperm is not working. Why it is fragmented? Because it is toxic. What do? Give antioxidants. End of the story. There is no treatment except antioxidant. So the best antioxidant we have in your platform. In your plate, you have Ganoderma, you have Spirulina, you have Cordyceps, you have lion's mane, and you have Morinzi. Now these 5 things, if you start without even knowing what cause is causing your infertility, before even going to a doctor, if you start these things even in little amount but regular, Professor Ratna says it takes about 6 months to 2 years. She has seen the first pregnancy after 2 years because the person cannot afford IVF. So he waited and kept on taking the Ganoderma and Spirulina. The swellings of the tubes, the swelling of the epidermis, the swelling on the testicular tissue, the quality of egg, you cannot increase the number. With the age it is going down. You cannot increase the number of the sperm, but you can improve the quality. You can improve the work of sperm. You can improve the fertilizability. You can improve the growth of the embryo in the dish. So the antioxidants, the antitoxins, the repairing processes, and above all, the biochemical ingredients, the soup needed for the embryo to grow is there in Spirulina and Morinzi.